Hey everyone, CJ here with Ashley to bring you a couple exciting announcements coming up soon. We want to make sure we highlight it so you put it on your calendar. And the first one is Hit the Hill Day, March 31st. This is probably one of the most important things of the year that we need your help with. If you only do one thing all year to help, please make it Hit the Hill Day and come on down and help. Ashley went last year, so kind of tell us a little bit about your experience and what it's like.
Yeah, it's actually super fun. You get to go down, you get to see how the government really works, which is kind of mind blowing. And then you get to talk to your senators and your representatives, and you're just going to promote the profession and tell them what athletic trainers are and why we're great. And that's it. And that's super fun. It's great to meet all the other athletic trainers coming down to do it. And it's really, really cool to see how all of that works because it's quite a fascinating process.
And it takes like 30 seconds to talk to him, and
Yep,
then the
that's
rest is
yeah,
kind of
and
us
yeah,
just
you
walking
only
around.
you make it short and sweet. It's a little elevator, combo. Like, that's
Do
it.
they give you like a script to read or kind of talking points?
Sometimes they give you talking points, but it's a good idea to come prepared, and we can try to put something out here. So if you wanna bring that down to Hill Day, we'll put something together for you guys.
And you can come meet all the other athletic trainers who are down there and working with you.
Yeah,
Yep.
it sounds like a fun time. If you have any questions, let us know. Let Casey Marlatt know. She's the committee chair for the Government Affairs Committee. And we hope to see you there. It should be a lot of fun, and it is super, super important. So please consider going. Again, that is March 31st, and I believe it's from 9 to noon ish,
About,
somewhere in
yep.
there. Okay. The other thing that we want to bring to your attention is the RMATA is coming to Colorado this year. So the dates for that conference is May 29th to the 31st. It's down in Colorado Springs. We need to have a huge showing of Colorado athletic trainers at this conference. So please put that on your calendar. Do what you got to do to be there. We want to make sure we have a really, really good showing. So RMATA in Colorado Springs, May 29th to the 31st, and we will see you there. Hey everyone, thanks for tuning in to the CATA Secondary School Podcast. I'm your host, CJ Rosenborough, and in today's episode, we're discussing navigating the return to play decision. And we're excited to have Katie Wallace and Ashley Cowan with us to share their insights and experiences as always. But before we jump into the conversation, let's quickly break down what we'll be covering in today's episode. And full disclosure, I am not sure how this episode's going to go. We have a lot of research, a lot to talk about. So we're going to try and keep this on the tracks, but I make zero guarantees. So this is a rough outline of what the episode's going to look like. Start with a quick introduction of return to play, and then we're going to go to making the return to play decision through the athletic training facility. And then we're going to hop into what it looks like when you're on the sideline versus the athletic training facility. And then we're going to finish off with a couple special considerations on some injuries that we kind of just want to chat about what that return to play decision looks like. So before we hop into that, Katie, what's up?
Well, I was just going to help you out. I think where we're going with all of this is return to play is all about functionality, and making that decision should come down to whether or not they can safely function within their sport. So we're going to hit so many things about decision making process and the research behind your reasoning for making that decision making process, objective measures for that. However, truly what you're looking for on a very basic level is their ability to function in their sport safely.
Yeah. So when I was making this outline, I started with ankles because that's what our producer Amy did an incredible job with a massive amount of research. And there were so many articles on ankle and lateral ankle sprains and returning too early. And I was like, okay, so we'll do this kind of lower extremity, upper extremity. And then I was like, well, we need to talk about this and we need to talk about knees and we need to talk about this issue, this issue. So we could probably do like 20 episodes on this and just cover the research on certain areas. So we're going to kind of stay a little bit more surface level. We're going to dive into a couple and kind of get some research to expand on some things, but we might go down some of those rabbit holes of more detailed stuff, but we'll see. It'll be good, I think. Fingers crossed. So starting off, this looks different for everyone. I think the return to play decision, while we do have our parameters for what we look for and what we go through. I think it's a little bit different for every single AT, depending on where you went to school, where you're currently at, where you're at experience level. Everyone has kind of developed a little bit of a different return to play. They all have their own preferences. So Ashley, what does this process typically look like at your school?
At my school, it is, I'm gonna say we're a little more laid back. Um, I have learned now through my 14-ish, 15-ish years in this career, that you don't make any friends by holding everyone out all the time. And you, in fact, make many enemies. So I have I've adopted this. These are my suggestions, you do you. And then I tell coach, these are my suggestions. I don't think they should play, but you do you, and it's on you now. And that goes over way better. And oftentimes the coaches, at least initially, if they're skeptical, if they're a new coach, they don't know me very well. And then they kind of figure it out and they're like, oh, okay, yeah, we're just gonna go with whatever she says. And so it's just typically easier. But that way they also know that I'm not gonna be one of the athletic trainers that just holds them out. And that also prevents the hiding of injuries and stuff like that, a little bit. So we're a little more laid back, and I try to teach the kid how to feel your body, what the pain is, what pain levels should be, and the functionality that they need to actually do their sport successfully, safely. And then I let them make their own choices.
I think that's the biggest like issue that a lot of new grads or early emerging professionals have is we have these guidelines. It's like, well, this, I don't have this, so you can't play. And then that happens to everyone. And then it's, there is a certain fine tuning of like,
Yep.
here's my recommendation. Here's, and kind of framing it as a team discussion of like, I don't think you should play. So I like that you brought that up.
Yeah, I think
Katie.
that team discussion piece is a really good cue there. I think it goes a lot further than just being the bad guy that says no all the time when you say, okay, so here's what they are able to do. And I think one of the biggest things that made me coach friendly is saying, okay, but I actually wanted them to do X, Y, and Z at practice today because they need to start a progression. Concussion return to sport protocol is not the only protocol that exists, and there should be lead up to days. One of my coaches I get along with really well because we agree. If you can't practice at all the day before, then you can't play the next day. Let's not be crazy. We're not going 0 to 100. You cannot sit out of practice for whatever your reasoning is and then 24 hours later be completely fine unless we made that decision on a recovery basis, right? Everyone has an individual situation that applies. But if you're like, oh, I hurt my ankle, can't play today. Okay, so you can't practice today. So you cannot play tomorrow because you hurt your ankle so bad you can't do anything. So what part of practice can you participate in? The consensus statement from Sports Physical Therapy, it's in the British Journal of Sports Medicine. I cover this all the time. When I was doing my master's, this hit me so hard was and it's what I did, but I didn't have an outlined angle for it. Return to participate, return to sport, return to performance. Those are three different stages of practicing. So what are they capable of doing at practice? What are they capable of doing in a game? And then can they play fully? And how do you make those decisions? And there's a lot of articles, we have a lot of research for this that outlines it, but where are they today? What objective measures have they met? And then can they play? But also, can they do X part of practice? Which drills can they participate in? My ankle kids can do straight line running all day every day once they can, but they can't do defensive drills yet because they can't go laterally for a couple days. And those are the type of decisions that I kind of stick on.
That's a super good point, and I like what you said about the when they think they can just go 0 to 100, and because I have so many injuries that they're like, okay, well, I'm going to be in this cast for 3 weeks, and then I'm going to be in the brace for 3 weeks, so that means right then that date I'm going to be able to play in our rivalry game that night. And I was like, Oh, you think so, do you? Like, you are gonna be largely immobilized for 6 weeks, and you think your muscles are gonna be ready to play in a game? Like, let's think
Right, we
about
don't
this.
jump from a walking boot into full gameplay.
Correct.
We progress. If you have to wear a boot all day at school, then maybe we shouldn't be practicing yet. We can't you are not going from boot to game ready. Like the Velcro to lace ups is a whole new world.
But they do that in other sports. They
Yeah.
go boot and then they play back into the boot.
I've seen a legit doctor's note this season that said, "No practice, no full weight bearing, no pitching, but able to play full, no restrictions for senior game on this date."
Well,
I've
okay,
seen
and
that too.
I have been the person
Blows my mind.
who went boot because they were receivers. Again, individual
Mhm.
basis, boot, running, back to boot. But they had to be in their supportive shoes and they were running the, four, whatever, 100s or whatever it was. And then they were back in their boots and they were never actually on their heels. But, but but again, specific injury basis, and we did it with that thought in mind. Mind you, they were also doing a lot of other rehab. So then I needed them in the boot to protect the growth plate, but they were also capable of running as long as they weren't on their heel.
It's very injury dependent, and the boot, I use the boot all the time. I love because I'm like, hey, you're gonna heal 100% of the time you're in this because you're not using like the lower extremity ankle is so hard because you walk, so you never really get to heal stuff because you're always kind of using it. And we'll
Maybe
get into this.
crutches was a better example. Crutches gameplay. Crutches is probably more
Yeah,
accurate than
yeah,
boot.
that was yeah. I feel
I
like boot,
put
yeah.
myself in a corner there. Sorry.
No, I like that though, and we're gonna get into that a little bit, as to how it's like very injury specific. But so when you guys are having this conversation, with athletes, parents, and coaches, of course, it's gonna look a little bit different in the athletic training facility versus on the sideline. But what does a typical conversation with the group look like for you, Katie, regarding this decision? Are they part of the decision? Are they told the restrictions? Is it a little bit in between? Because sometimes you have to be like, no, is not safe. What does that look like for you?
Yeah, I usually try to have, especially acute injuries, like it just happened. What are we going to do next? What's the plan? And I always say, we're going to reevaluate every day. We're going to see what they're capable of doing every day. And once they are able to fully function again, then we will get them back into their sport. They are expected to be at practice every day. I make that very clear. I if they skip a week, I'm like, hey, I have no idea where you're at functionally, so I can't make a decision. You can't play today. If you show up on game day and that's the first time I see you, nope, you can't play today because I don't know and I don't have time to test you. We're not throwing you back into a game day situation. Again, you're not going 0 to 100. You haven't even come to practice. How am I supposed to trust you to play today? And I outline, especially when it's an acute injury that I know is going to take a little time. I outline, okay, they have, we're going to go through a progression. They got to be able to jump again. So we're going to make sure they can safely jump. But every day they're going to come in, they're going to do, their rehab, and then we're going to do some functional movement progressions to see what they're capable of doing. But they have to be able to perform, and their coach is going to help me make that decision as well. So, an ACL totally different than an ankle, right? Depend because of the amount of time for rehab. But even my ankles, like a day before ankle sprain, we all know some of them, and I have this conversation so often. It's just on repeat in my brain, I think. But some people, the pain of an ankle sprain is stupid. It hurts so bad. And then the next day, some of them have their ankle is 3 times the size of the other one, but they have no pain anymore and they're fully functional. And you're like, what is happening? Why are they able to function like that? Other people have no swelling, no bruising, but they can't even walk on it. The x-rays are negative. All of the testing has been done. And they need 3 days on crutches before we can get them to do anything. And so I always tell parents, this is whole situation where it's totally dependent on them and their own recovery. Each ankle sprain is individual. I can't tell you how long it's going to take because the book is a bad reference for how an ankle sprain is going to heal. So tomorrow when they come in, we're going to test them. And so my ankle sprains, if they sprained it yesterday, I sent them home on crutches, but today they're walking and running just fine. I'm going to have them go out and I'm going to have them run lines. They're going to do some line jumps. They're going to do a pistol squat or a single leg squat as deep as they can because they're high schoolers. They're going to do tuck jumps. They're going to do defensive drills against the best player on their team. So I know they're fully capable of defending in a game before I let them play. But they do some form of testing before they decide that they're going to jump on the table and just get taped. Because, when I do rehab, I don't tape for rehab. I a lot of times will send a kid into the gym, go do dynamics and warm up shooting with your team, then come back and talk to me. And they're like, "You're not going to tape me?" I'm like, "No, because I want you limited to what you're actually capable of doing so that you're not just like, well, I'm invincible now because I'm taped. I want to know." And so I send them out and then I have them come back to do the rehab because they realize, oh, yes, this still hurts to do X, Y, and Z movement. Yes, that's why, because we still need to strengthen. You're inhibited by the function of your ankle still. We want to facilitate that. And in a game, sure, we'll tape preventatively to give you a little bit of input. But for rehab purposes, I want you protected. So I use that to help make my decision. And also then their coach sees how they're functioning without the tape on. And you guys having them in the gym, having them in front of their coach so their coach can see them function. Like, I'm not an expert, but if you have a coach who knows running strides and how they're supposed to look when they run, and you send them out to run a 100 on the track in front of their coach will give you a lot of input on whether or not they can run the 100 today. And it's like, I don't always see it, but their coach will. And so having the coach's input helps the coach make that decision as well. On the flip side, if you have a kid that's performing really well and that hasn't been cleared by a doctor yet, because I could tell you that story, then their coach wants to put them in 100% for play and you're trying to limit minutes, you have to stand on that argument as well and be like, no, this is why. And I've had coaches who are like, come tell me when it's time, and I just go tap them on the shoulder and tell them, hey, he's got his minutes in for this half, please take him out because otherwise he's not going to be useful to you and you want him for more games. I also have that conversation a lot of the time. I feel like I've been talking forever, I'm sorry, I have a lot on
No,
this.
it's good stuff.
When I tell them all the time, it's not just one game. We're looking towards the end of the season. We're looking towards your career. I don't care about the game tomorrow. You have 4 weeks left in the season. You have 8 weeks left in the season, however many more there are. If you miss one game, the world won't end, but your career could, or your season could, if we let you play one and get another injury, because everything is interconnected. So I don't care that tomorrow you have a game. I care that playoffs are in 2 weeks from now and we want to make a run towards whatever your goal is, and so I have that conversation a lot too. And I get injured in my gym, you guys. It's a long conversation. I always feel bad. But it's all of these things are important for them to know when we go into it, that we're not just saying, yes, you can play tomorrow. No, you can't play tomorrow. There's a million things going through my mind to make that decision.
I really like the tape point that you said. Like if you're sending somebody out to do either rehab or even, hey, you're going 50% in practice today, and they're like, well, can I get taped? I'm like, no, I want you to go 50. You're not going to know what 50 is if you're taped up, or you're going to be too confident and it's not going to feel right. So I really like that. Ashley, what does it look like on your end?
Yeah, I try to do just a ton of education. Because another thing I also think about is when these athletes are no longer my athletes, they're going off into the world. I want them to know my thought process behind these decisions so they can better make decisions in their life too. So I'm really good at, I try to talk to the athlete and the parent and the coach, and we're educating them on, pain scales, pain levels, pain tolerance, ability and function. And then again, like Katie said, like we're going to check back every day and we're going to see how you're progressing. And then because that's not an assumption I've learned, they won't assume that they actually have to come back to see me to check in every day. And I was like, so you have to come back and see me right after school every single day, and then we'll get you back. And I really try to spell out everything they have to do and things that they need to be doing on their own for recovery. And then I try to give them the carrot at the end of the stick. What do you want? Do you want to get back to playing this game? Well, if you want to play in that game, these are the steps we have to take to do it. And if you don't do it, so like if you're not doing your rehab and you're not strong enough, then you don't get to play in the game. Um, and so I just lay it out and I put it all on their plate. And I think they take a little more self responsibility. And so I think that works fairly well. And then you'll also weed out the kids who are lazy and don't actually want to get back to play pretty quickly.
Very quickly. Yeah.
Yeah.
Yeah, I like CJ that you hit on the percentage, like 50%, right? Um, Muscle injuries, I use a lot of percentages with kids. Like a hamstring, right? The hamstring has to be stressed for it to get better. And that I talk all about the ups and downs. I waved my hand and you guys can't, not that anyone else can see it, but the ups and downs of a hamstring injury or a quad injury when you're dealing with them getting back into running and then they feel good. So they push it and then the next day they
Every
hurt more
time.
and they can't. Right. And the hamstring is stupid. And if you look on research on hamstrings, which I don't think that we put into our references here, but we have enough and you can find it on your own. But the hamstring has to be stressed just to the point of working, but not to the point of it's not being able to work anymore. And so all the time with my hamstring injuries, I'm like, well, what percent do you feel like you can run at today? And they're like, 75. Cool. I want you to run at 70% then. And that takes a lot of education to Ashley's point. It is hard for a high school kid to understand what you're asking. What do you mean you want me to run? They understand 100% and 0%, but the in betweens, especially not 50, are hard for them to grasp. But the I think we referenced the psychological scale somewhere, the psychological return to play questionnaire, the outcomes measure.
Hmm.
I a lot of the time, what percent are you at today? What percent are you at today? What percent are you at today? Because that dictates some of what I'm going to have them do, especially for a running athlete. I need to know how much we're stressing that muscle today so that we can help it function because we want it back to 100%, but we don't go again 0 to 100 with that functionality. You're going to re-injure it. And hamstrings are stupid that way. Maybe all muscles are stupid that way. The hamstring just takes the brunt of the uh I don't know.
Stupidity. Yeah.
Yeah.
It's a
It's
finicky.
it's the
Yeah.
one we know the most about, right? Like your
Hmm.
quads help you stop, your hamstrings have to propel you. And when your hamstrings aren't functioning, you can't run. And good God, everybody's mad about
I
them.
would toss the hip flexors in there too. They're pretty.
Agree.
Yeah, they go as as fast as the hamstrings a lot of the time.
But
I
the
think
hip
this
flexors don't re-injure as frequently. The
not as frequently.
hamstring,
Yeah,
yeah, the
hamstring, you'll
hamstring,
sneeze and you're like, oh god, I just pulled my
yeah.
hamstring again. I'm like, oh jeez. I think this was from a CEU that I did. I tried to find the research, but I couldn't quite find it. Although I didn't put a huge amount of effort in. But there was a CEU that I watched on MedBridge that went over the perceived effort with the percentages versus what you actually do. And I think it was more based on heart rate. So I'd be curious to see like the muscle. But just for our runners, if we're saying, okay, I want you to go at 50% intensity, they're actually pretty good at getting within, I think, plus or minus 10 beats per minute of what that intensity would be on their heart rate. So it's a good way to do like cardio restrictions. I don't know if I say I want you to do 50% of your hamstring strength. I don't know if I haven't seen any research that shows the validity or not the validity of that. But at least for cardio it works. So when you're getting them back to running, it is a good way to kind of regulate them. Um, do you guys use, with that being said, is this primarily, so these are for like our kind of our longer term, like 2, 3, 4+ days of rehab. Do you use your rehab to guide your return to play decision making? And do you say, okay, you can do this in rehab, therefore it makes sense you can do this in a game, you're going at this percentage? Or do you also sprinkle in diagnostic testing or functional testing along with that? How does that look for you, Katie?
Yeah, I do a lot of functional stuff. I did FMS, SFMA. I do like a full they tell you not to break them down and do them separately, but sometimes they get broken down and done separately just based on like if you can't do a squat, but you couldn't do a squat in the first place, like watching a high schooler move is a crazy situation, right? Like, good God. Um, but I do make them like, okay, how's your toe touch today? How's your squat look? Like, what's our baseline function look like today? And then yeah, I do, jump. If they can't jump yet, then obviously we're not jumping. But once we're there, why can't I play? Well, jump. Okay, see how your knee does that buckling thing? I don't like that. You can't jump yet. Can you do a single leg squat to a box? No, you can't even stand up on your own yet.
I like how
What
your
do you
reasoning is,
you
I don't
can't
like that.
well,
No, I
they
don't like it.
okay, but they can feel why I don't like it. Watch them wobble around. They can't even get to the single leg stance before you have them do a single leg squat and you're like, "How did you play this?" That's why girls basketball players are on the floor all the time. You can't even never mind. So yes, correct. I do a lot of functional testing. I don't do a lot of manual muscle testing. Like I do toe raises all the time, but like outside of that, you're not going to see me with someone on a table doing a lot of manual muscle testing outside of um the initial eval. But ankle sprain, if they sprained it yesterday and they were a drama queen about it, mean it nicely. They're not trying to be a drama queen, but they were a drama queen. And then today they want to play, then yeah, they're getting a full, at least motion wise, manual muscle test to make sure that we're not able to perform any of the motions. But I don't. I do functional testing. I don't do a lot of manual muscle testing.
Well, that's good because I have some research later on that's pretty interesting regarding the manual muscle testing. So I'm excited to. I think you'll fall in line with what it says
Great.
based on what you're saying. All right, Ashley, how about you? What does that look like?
So I do as much functional testing as I can, but I honestly don't have a lot of time for it. So I do let my rehab guide a lot of those decisions. And then I'll do a lot of like quick functional tests, like the jumping, the hopping, single leg hops, stuff like that. Can they do the basic movements? And then I tell them to go out to practice and tell me what they can and can't, haven't been able to do. And then we just try to check in that way on, did you feel like you could do all of your drills really well and you were doing fine? Yeah, great. Like, no, which one? Okay, let's work on that. Like, so that's how I guide mine.
Awesome. All right, so let's hop into. That was the introduction. 25 minutes.
I know. I'm like looking through section one. And I'm like, oh God, we haven't even hit this.
I know that's well, we're gonna see how this goes. But it's gonna be a little bit of expanding what we've already touched on, which I guess is kind of what should happen after an introduction. So that's okay. All right, so we're gonna talk about what that return to play progression looks like specifically in the athletic training facility and kind of get into the weeds a little bit. So I think my biggest point to throw in first is you have to understand your timelines based on research and your experience. If you've got a kid who's saying, "Hey, I feel great," and they injured their MCL 2 days ago and had swelling, and they're like saying they feel great, that should send a red flag up of like, this something's not right here. That's really, really fast for that type of an injury. Also, but if they're golf, maybe we can get away with it if it's their front foot. If they're basketball, maybe a little bit less likely. So understand your timelines based on research. And there's a ton of research. We're going to give you 5 right now, but I could go on for days about how many articles there were. So Ekstrand et al. In 2020 and Wallen et al. In 2019 found that professional soccer players had an average time lost after ankle sprains of 12 to 15 days. T et al. In 2019 found that rugby players returned to participation on average 24 days after injury. So like twice as much as the minimum amount for the previous studies with soccer players. Swenson et al. In 2013 found that high school athletes that have a more severe injury involving multiple ligaments resulted in greater than 3-week loss of participation. That was specifically for ankles. And then McKeon et al. In 2014 did an assessment of recovery time in high school athletes after a first-time ankle sprain and found that there's a 75% chance of returning to sport within 3 days after the injury for that first-time ankle sprain, and a 95% chance of returning within 10 days with no difference between new and recurrent ankle sprains.
When I say the book doesn't give you a good answer on ankle sprains, that is the article that I mean. 75% in 3 days. Was it an ankle sprain or were they being a drama queen?
Right. Yeah. So it could be, hey, you're back in 3 days, or hey, you're back before 10, 95%. chance likely. Like that's a big window. That's an entire week.
Yeah.
So understand your timelines, understand everything's gonna be different. And I think the biggest point of this is sport is gonna play a huge factor. Like if we look at that rugby versus professional soccer one, professional soccer found 12 to 15 days, rugby was 24.
And your level of performance matters because Lindsey Vohn's about to ski in the Olympics.
With no
So
ACL. Yeah.
He's
with no
jumping
ACL.
already.
I know, it's wild. But also, high school athlete, you're not Lindsey Vonn.
Yes, you do not have the musculature
and-
of Lindsey
and-
Vonn.
You're not a professional elite skier. You're a basketball player or whatever other sport
Mhm.
you're playing right now. Just be clear. But your level of play matters too.
Yeah, and that's a great example. So when you look at the downhill skiing versus basketball, that lateral movement that puts the ACL at a huge risk, you're a little bit more stable with the downhill skiing. You are still highly at risk for ACL tears, but you're not having that drastic change of motion. You're having the cut, the hold stability. She has a whole lot more muscles. And correct me if I'm wrong, because I haven't looked into this a ton, but I think it was a full rupture. So there's no ligament left to tear. There is nothing pulling. She can't it's not a grade 2 and she can pop it the rest of the way and then cause more swelling, more pain. It's gone. So if the swelling and pain is under control and she has enough stability, like NHL hockey players do that pretty frequently in the Stanley Cup playoffs. They hurt their knee and then it comes out after, oh yeah, they tore their ACL and they're still playing. Sport depends.
I think it also matters. I mean, I'm not going to speak for her on this, but I'm going to guess this is her last run at it and she just spent 4 years preparing. Like, I'm sorry, high schooler who has 3 more years left to play or college to play. Like, you've got 8 years left that you need this knee for. She probably knows whatever damage she does to that, she's already having surgery, but she also knows this is her last go at it.
And it's only 2 weeks. Like
Right.
the risk of arthritis for going 2 weeks without, or I guess it'd be 4 weeks from the time of her injury, but you got to think it's less or lower than if you're trying to go through a 2-3 month injury.
Right.
I'm not an expert on that, but it just passes the sniff test for me at least, which is how I live my life. Okay.
The sniff test.
It seems okay. Let's dive a little bit into what factors go into your decision for getting them back on the field or court. Let's start with manual muscle strength, and then we'll kind of touch on range of motion a little bit. And Ashley, I'm going to throw it your way. Do you go 5 out of 5 strength? Do you go 4 out of 5 strength? Do you go 3+ out of 5 strength? Where do you fall on that? Strength needs to be close enough.
I try to make sure it's at least a 4 out of 5. The 3 out of 5, that's a little sketchy for me because you're breaking, right? So I don't want that. But yeah, if you're getting close, then I want you out there at least moving it and strengthening it more. And then I just try to educate on, you're not back to full strength yet. So just be careful, listen to your body, that kind of thing.
How about range of motion? Do you wait until you get all the range of motion back, or you kind of, it depends?
Range of motion, I try to promote pretty much full range of motion. Now, what's full range of motion for them in a high schooler, right? These guys, you would think they're stretchy and bendy, but they are not.
I forget whose school I was at. I was like, none of your athletes' ankles move.
Yes.
They just stop at 90. I'm like, oh.
Yes. Well, in that, right, we're going to branch a little off topic, is because they don't crease their damn shoes. So they're walking weird.
Sorry. It's so true.
The number of times I've had to scream at athletes and their parents, like, I need you to buy them a pair of shoes they can crease so they can walk normal.
I literally just got a new pair of shoes and they're like, Katie, are you trying not to crease your shoes? And I was like, I don't even know what you mean, you guys. What is that? Like, they're gonna crease. I don't live my life that way. It was a moment. They loved them, by the way, just so we're clear. They love my shoes. They're mad that I'm gonna crease them.
Well, and I this football season, I had to teach this kid how to even run for the first time in his life, because he walks with the toe out gait so he doesn't crease his shoes, and it was getting so bad.
Is that why that's a thing?
Weird.
Yes. Oh my God, I see that all the time.
Yes.
It's because they don't want to crease their shoes.
Exactly. So yeah, ankle
This
mobility.
is the Colorado Secondary Schools podcast. We're talking about shoe creases.
You guys see what we have to deal with here?
It's ankle mobility has taken a huge hit because of the shoes.
Oh
Um,
my gosh.
so yeah, so it's you've got to judge what is their normal, judge looking bilaterally, right? Trying to judge what best is their pretty normal functioning range of motion, and that's I try to get close to that for sure. But yeah.
So I mean, this is obviously dependent. Like, I've definitely had ankles where they do not have full range of motion, and we tape it. We put moleskin on it, and that thing's not going anywhere if it wanted to. So I think we've said this 20 times. We're probably gonna say it 20 more times. It is dependent on the injury, on the time of the season, on the you're gonna treat things a little bit differently in their first rounds of the playoff if you're kind of on the fence versus first game of the season. You're gonna be more conservative. So it the time of the season, the sport, and the joint vastly makes a different
Yeah,
impact.
and the athletes, personality, how
Mhm.
tough are they? How much do I trust them to listen to their body?
Yes.
Are they a little ditzy? I'm gonna trust them a little less, like,
Yeah.
that kind of
Well,
thing.
and are they dependent on another athlete to help them, like a cheerleader, right? Like,
Yep.
if you're a flyer, you don't have a lot of control when you're up there, but also if you're a base, you don't have a lot of control over them coming back down on you. So,
Which one would you prefer? A base with a wonky shoulder or a flyer with a wonky shoulder?
Oh, flyer.
I don't know.
flyer,
If the base
throw the
goes,
flyer in the
everyone's going
air.
down.
Yeah,
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 Yeah.
I
the
care. Oh,
flyer's
you care
shoulder
less
doesn't
about the
matter.
flyer. Oh yeah,
Yeah.
that's right. Yeah, that
I
was
I
my
want that base's shoulder to be
yeah,
totally
that's what I was
ready.
thinking too.
Right.
Yeah.
Katie,
But
what does it
but a
look like? Do you
flyer with an ankle or base with an
uh,
ankle.
Yeah, they're both hard.
I
Mhm.
had a flyer with an ankle? Just throw them up there. They
Yeah,
got
but
some
you're
cushion with the
holding them
arms.
by
Someone
their
else
ankle.
is
That's a
holding their
Yeah,
ankle.
more stability. Yeah,
more
it's just
stability.
it's increasing stability.
CJ, I don't think you understand cheerleading.
I'm just kidding. I'm kidding. I was thinking more about the throwing up and then catching. You catch on your back. So I'm like, oh, it's not a lot of load on the
Yeah, no,
foot.
they stabilize their whole body through the bottom of their shoe.
Yeah, I can tell you've never done a cheer lift, CJ.
Nope. I was the base. I was yeah. I was not a
Okay, what was
flyer.
your question? What I do functionality. Sorry. I'm
So not a whole lot of
Functionality,
strength. Like,
full
do you go?
strength, full range of
Yeah,
motion.
yeah.
yeah,
What does that look like for you?
yes, I want full range of motion. I'm pretty good about pain-free range of motion being the first goal we meet and then moving on from there. After that, I want functionality. Can they it's a performance analysis. Can they do the demands of their sport at whatever level they are at to be performing that sport? Can they defensively guard against the basket or whatever for basketball? Like they have, if that guy's coming at 100%, can you at 100% defend against them? Or is the next guy in line better than you, right? We have that discussion with our athletes, helping them make the decision. Okay, at your whatever you're functioning at right now, are you better than the next guy in line still? Because that helps us make our decision. To be honest,
Yeah.
it helps a coach make the decision. Is this guy at 80% still better than the guy behind him? That makes my choice a little bit harder when I have to say, you still have to go to that next guy. I know he's going to hurt our team today. Um, but that's kind of helps with the decision making process as well. Like, hey, your next guy is really good. You guys are pretty equal. We're going to let him take the reps today. Helps with the decision making. So,
I've said it before. One of my favorite lines to use with coaches when I'm like, "Hey, this kid, technically he could go and probably be okay. It might set us back a day or 12 hours with but whatever." I always tell the coaches like, "Hey, technically he could go, and his risk of re-injury, I'm not super concerned. He's not going to be effective at all. Like he's shown me he can run, he can cut. He's just slow. He can't go very fast. So it's probably better for the team if you guys don't put him in because he's not going to really help at all."
and those help to have them at practice so the coach can see them.
Mm-hmm.
Because
Yep.
then they know it's not just you making the decision. But again, I hope everybody gets to this stage one day where your football coach walks in weekly or every few days to be like, hey, how's this person doing? Hey, how I saw this guy do this. That didn't look good. What are your thoughts? Like, just so you're in a constant communication
Mm-hmm.
about where your athletes are. I hope most high school athletic trainers are getting to that realm of relationship with most of their coaches, because it does make our job a lot easier.
Yeah, keep them updated every step of the way.
Mhm.
So we're going to stick with ankle just because we're on the lower extremity and ankles are kind of the low hanging fruit. So Smith et al. In 2021 proposed, so we know that there's a high prevalence of recurrent ankle issues. We all see that. The literature agrees with that. So they proposed that premature return to sport may be one factor that contributes to that high prevalence of recurrent ankle problems. So ankles are kind of, like I said, the low hanging fruit because they're the ones where we just go a lot of times, it's an ankle. Like you're biomechanically sound. Yeah, it might hurt. Yeah, you might have a little bit less power, but it's an ankle. Let's try and tape this thing up, lock it down, and let's roll. Ashley, what does that look like for you? Like when they're getting back to that return to sport to make sure that you're not prematurely, because you see them doing the rehab, you see them in practice, like, I think they're pretty good. Do you purely use your rehab progression? Do you add in, okay, we did your rehab. We're also going to do a couple tests here. I'm going to have you jump. I'm going to have you do some cuts with me. Do you add that in there? Or is it purely okay, we did this yesterday, felt pretty good, so now we're doing this today?
Nope, definitely adding in the tests as needed. Like if I'm seeing that they are seeming to be a little dysfunctional in something, we're definitely gonna test it out, suss it out, figure it out, and then give a new rehab exercise for that. So yeah, it's gonna be a day by day. Maybe that'll change. So yeah, that will constantly change for me.
Katie, what about you?
Yeah, same. I want to see them do, like I said, like a depth jump where they're falling from the box. I want to see them do that. I don't usually include that in my rehab, so I'm going to add that and then be like, oh, we need a little hip stability here. And cover that and make sure, it might not be a disqualifying factor, but suddenly now okay, well, now I need you to do this every day before you go to practice, because now maybe your hip strength wasn't the cause of your ankle sprain, but it's going to be in the future if we don't handle it. So yes, you're back to where you were functionally to return to the level of play you were at before, but now I know where the problem came from, so we got to fix that too. So now you have hip school. That was in our last episode comments, and you can go find my hip school that is required. So but yeah, so it doesn't always disqualify them with the testing if they're back to their level of performance, but then now we have new rehab that I want you to take into consideration, and it's not maybe mandatory, but I need you to know you could have more problems now that we found the cause of the initial problem or a contributing factor. So
Yeah. Um, so we're gonna hop right in because that was kind of a good segue with using that. Was it a deep? What'd you say it was? What squat?
depth jump,
Depth
jump,
jump. Yeah, thank
yeah.
you. Goodness.
It's not actually a jump, everybody. It's where they fall off the box. They just like walk off the box and you watch their leg. Just to be clear, if for some reason the word jump in there is, everybody's like, what does that mean? Like
It's a fall.
it's a
Depth
fall.
fall. Yeah.
Sorry. I don't know why jump is in the word. You can do them where you jump afterwards, right? Like,
And it's kind of getting into the
yeah.
last test. So one of my favorite things to do is, because it's hard to do all that diagnostic testing. It's like, oh, you're getting ready to return today. We're going to do all this testing. So I actually incorporate it into my rehab, and then I use it as my rehab, which helped a ton. So I'd use not so much scar excursion balance testing, but the Y balance lower quarter testing.
Yep.
Because you can test them one day and have a student or have them just write down where they got to and not lie, and then have them do that exercise through rehab and then test them again a week later or 4 days later and see, like, okay, how are we looking, how's it improving? We're
Yes,
just having
some
to do
of
that
us
exercise.
nerds just have it taped on our floor.
Yeah, I did too. Yeah. um
We recognize that we are nerds, everybody. We know you don't have to have a Y balance taped onto your floor, but if you do, maybe it's easy to do the rehab on it.
Yeah. And you can look at them and just see, like, okay, I know, yes, like 2 days ago you were struggling with that anterior reach. You're looking a heck of a lot better now. So my
Right.
diagnostic testing is I can use my eyes to see you're getting further. I don't really need to measure it, so to speak. And going off of that, the scar excursion balance test, which is very similar to the Y balance lower quarter testing, it just has more directions. Um, Zhang et al. Did a study in 2025, so hot off the press, that found that exercise therapy for chronic ankle instability improved star excursion balance testing performance, but didn't evaluate whether achieving specific star excursion balance testing thresholds before return to sport reduced subsequent re-injury rates. But that exercise therapy does improve that. So you can kind of see the efficacy of your um, rehab as far as, is it going to improve that star excursion balance test? It's a good way to see if that's improving, and therefore your exercise therapy is targeting what it's supposed to be targeting. Couple other ones that I liked using a lot for rehab, and this is kind of like when we get into that ballistic testing and agility, the single leg hop testing, both side to side, forward hop, triple hop, crossover hop. Those are great rehab exercises, and you can really judge you can go, hey, I want you to go 50%. You're going to jump forward at 50%, and then you're going to hold, and then you're going to jump forward again, you're going to hold. And then next time you go, okay, cool, go 65, 75%. And then they gradually get better, and you kind of watch them and see, okay, we're getting pretty close to that. Crossover hop looks great. Crossover hop is a lot of load on the knee, the ankle, the hip. That alone can tell you how close they are to returning to play. Like if you're just doing single leg stance with ball toss, or you're doing like ankle strengthening, that's not going to give you a lot of information. You got to get that higher end level of rehab to be able to see, okay, that's a basketball move that they're doing right now. It's a Euro step. Is it a Euro step? Something where they 1, 2, 3 layup, kind of, but it's both legs. So you can see this directly applicable. You can see how they feel. Dynamometry. So it must be in the next one. It is in the next one, so I'll hold off on that one. But you can use dynamometry to see where their strength's at. The problem with that is, what was their normal? It's kind of hard to tell. You can't really compare bilaterally because their stance leg might be the left leg for soccer, and they kick with the right, so their left might be stronger for stabilizing. And then, so it's just kind of, that was a little tough. But one of my favorite things to use, and I said this on the last episode, is outcome measures. They give you a really good measure of where the kid's at, both what they're reporting physically and psychologically. They don't take very long to make. You have to print them out and like calculate it, but you can make forms to do that for you. But the FAM, FASH, IKDC, the lefts, they all use greater than 90 as return to pre-injury levels. 75 to 89 is moderate risk of re-injury, and below 75 is severe risk of re-injury. You can see how they're doing in their everyday life and in their like sport specific movements. And that can just help give you, it's another piece to the puzzle, right? There's no like smoking gun here where it's like, FAM is above 90, we're good to go. Like, okay, well, we have to look at everything and take everything into account, but that's a super powerful tool to use for that return to play decision making. The hip has the Hagos, and then one that we probably forget a lot about, and I think Katie, you might have mentioned it earlier, the IPRRS. Anybody know what that stands for? Injury, psychological readiness to return to sport, maybe.
Probably. Sure.
And then the ACL RSI, ACL return to sport indicate, I don't know, for psychological readiness for return to sport. Those will give you an idea of, is the athlete mentally there? And if they're not, I always do these ones a little bit before they're getting ready to return, because then I can say, okay, well, what's got you not confident? Why is our score this low? What can we address? Okay, you don't feel confident jumping up and down and getting a rebound and landing. Okay, well, let's work on that. Let's specifically do that in our rehab. And then let's test it out, and let's go out there and let's show you. Let's have 5 people stand around you under the basket. You jump up and get a rebound with no one moving. See, that wasn't that bad. You didn't roll your ankle. You didn't step on an ankle. Everything's fine. All right,
Throw
now
him out of bounds with a blocking pad. It's fine.
Yeah. You said that last episode. Beat them up.
Yeah.
Show them that they're ready
Nobody's going to hit you as hard as I hit you.
So those are some of my favorites to use. And if for those of you who are like, diagnostic testing is so hard, it is in the high school setting. It's very hard to be able to do that functional testing. But implement it to your rehab, and that can make your return to play decision a whole lot easier.
It also helps parents. I worked in a clinical setting for one time, and I had
one time.
Well,
this one time.
Just the once. Yeah. It was a long-term one time, but I had a parent who hadn't been coming to rehab just because 3 times a week, 2 times, it's frequent, whatever. They're old enough to drive. Mom hadn't been there, but we were ready. We were ready to clear for full return to play. and we were doing the testing for full return to play, and she was nervous, but she came to testing, the last day of testing, and then she watched us do all of those scores that all have to be within 90-95% of the bilateral side, right? And she's watching them and she was like, I did not know this is what we were doing in here every day because she had been there for the post-op, she had been there post-op, the beginning stages, and then she kind of stopped coming, which I get, totally get it, time consuming. But then she was nervous because all of a sudden she knows the re-injury risk and they're ready to go back to play. And she came in for testing and she was like, I was like, okay, mom, how nervous are you? She's like in tears and she's like, I'm not nervous anymore. And I was like, oh, that's so sweet. But it is, once you see it, you're like, oh, okay, I'm not worried anymore. They've outperformed what their sport demands of them. So
The one I will say that the nervousness never goes away is the ACLs. Those things are
yeah.
strong, but I'm always terrified when they're on the field. Even if they've they're 12, 13 months out, they've passed everything. I'm so scared when they're on the field. Terrified the whole time. Other than that, I'm pretty confident. Everyone else.
I don't know. You do make their
ACL
rehab
scare
way
me.
harder than their gameplay is, and suddenly it slows everything down for them.
It is, but
This is that's far surpassing what this particular episode is going to be.
yeah.
But
Maybe it's the time and the whole load that just makes me scared. I'm like, what
and
if
just the
something happens to the other knee?
knowing that other people have done poor rehab and therefore the
Mm-hmm.
numbers exist that say that even your rehab could have poor outcomes.
Yep.
But if you did your best job and you did all the testing and you did it the right way, have confidence in yourself, CJ,
Oh, I
who's been
do.
doing
I
this
got
a long time,
100%.
and other young professionals.
Yeah, 100% return rate without re-injury.
See? So why are you
All of
nervous?
my ACLs that I returned are now graduated, so I can claim that without having to knock on wood.
So
I'm
stop
safe.
being nervous, CJ. Have
I
confidence.
can't help it. I'm a nervous Nelly. Okay, we're gonna go into upper extremity injuries, which Ashley, I think you said on our last episode, this is your bread and butter, right? You like shoulders?
Yeah, I do. Shoulders are just fun.
Okay, you explain away because I'm not a huge fan of upper extremities.
You get to make them do the funniest looking rehab exercises, in my opinion.
That is true. That is true. So for upper extremity, obviously it's again based on your understanding of timeline of based on research and experience and their sport and their demand and their joint, all that good stuff. Do upper extremity, I'm thinking mainly the shoulder. Does your factor of what their strength and range of motion looks like, is it different? Because for me, it's you got to have 5 out of 5, like very confident 5 out of 5 full range for the shoulder. Whereas ankle, I'll let you go back in with 4 plus out of 5. We can modify that, but the shoulder is just it's not really a joint; it's just an articulation. So,
Yeah,
what does
and
yours look
it's
like?
so easy to be unstable.
Mm-hmm.
So, yeah, I agree. I do really hound on that 5 out of 5 range of motion. Again, they're normal 5 out of 5, because that's going to look different in your overhead athletes, where they're going to have excessive range of motion. But um, yeah, the it's hard to have 5 out of 5 strength in all of the planes of motion in your shoulder because there's so many, and
Mm-hmm.
almost every single kid I've ever met has some sort of shoulder dysfunction, even if they don't have
Yeah.
shoulder problems, right? That 17 muscles that attach to that scapula are not all working like they should because we all have terrible posture and we all just sit on our phone and play games all day instead of
Every
that.
child has scapular dyskinesis.
Every
All of them.
child,
Yeah.
yes.
Yeah.
So doing tons of those scap stabilization exercises are great. And again, one of my favorites is having them in quadruped position, doing shoulder rolls with their elbows straight. And it looks so funny, but you can very quickly see where they can't move.
Mm-hmm.
And then all they can do is like up and down, and like they have no other motion. And it looks funny when they're trying to do it, and everyone in the athletic training room is laughing at them. But yeah, it's such a good exercise because one, it shows where they're deficient. Two, when you're making them do it as a rehab exercise, it's so good for shoulder mobility. And then for three, it's going to strengthen them up so much better. But yeah, so shoulder is a trickier one, and they're always going to have some sort of dysfunction. So it's hard to say that they'll be back to full everything before I let them play.
Mm-hmm. How about you, Katie? Are you more strict with shoulders regarding your like manual muscle testing and range of motion versus potentially some other joints?
So I'm just gonna say that I use the company I used to work for had a shoulder return to sport, and I just default to them. I don't know how much shoulder people do research, but I know that Kevin Wilk is kind of the guru on the shoulder as
You
far
see his
as
name
rehabilitation
everywhere.
goes. Yeah, his name is everywhere. I happen to work for the same company that he worked within, so we got access to what he does, and so I just kind of used those tests as my go-to. Him and Dr. Andrews, I think, is out of Florida or Alabama, somewhere in the South, and is kind of the baseball guy as far as shoulder goes and overhead athlete goes. And so I'll be honest, I just use that research. You can find, again, Wilk's name is on just about every shoulder research paper that comes out anymore, I feel like. And so
Mm-hmm.
there's a lot of, if you look into shoulders, you guys, I hate the shoulder, so I try to do continuing ed on it. And there's a lot that says do these specific tests. These are the ones you use for motion, and here's your guide for if they're, there is the same as the Y balance lower extremity. There's an upper extremity for the Y balance. I do use that
Mm-hmm.
um, because there is good research on it. And but to say that I'm good at it is not true. I use my resources and I know that they have done the research on it. So I train my rehab to fit their categories and what they're capable of doing. But I am a big scapular stabilization person, so I don't so much worry about range of motion in the arm as far as making sure their scapula can move separately from their arm and is set to their body and their posture is better. Um, and then high level baseball players, I'm happy to refer out because I it's too much for me if I'm being honest.
It is. And you know what I hate? Elbow. Why? Like particularly in our pitchers.
Mm-hmm.
Because there's just so much overuse, and the wrist, or well, technically like wrist muscle tendonitis, the epicondyle tendonitis issues are so hard to kick. And I'm
Yeah.
dealing with quite a few of them right now, and we're doing all the strengthening stuff, all the massaging. And you know what I can't get these boys to stop doing? Playing video games. And it's that constant like hand tension, finger motion on the remote controllers or whatever. And they come back like on a Monday and they're like, "Oh, I don't know what I did this weekend, but my elbow's killing me." And I was like, "How many hours did we play video games?" Like all weekend. Yeah. Like stop it.
You grip that controller tight. I don't think
Yeah,
kids
and when it's
realize it.
stressful, you're
Mm-hmm.
really, and a lot of the thumb, because it's largely thumb movement, right? I mean, I know there's more. I don't play a ton of video games, but the thumb tendonitis and tendinosis issues from also texting and being on our phones, but it's become this huge kind of issue lately,
Mm-hmm.
and
Yeah,
it's
I blame
really hard to get
posture
rid of.
a lot. That posture business, they live
Yes.
rounded shoulders, head forward
Yeah.
motion. And just like every kid that comes in, I'm like, can you just sit up straight? Lift your sternum up. Lift your sternum up. Just and try to be up here. And like a lot of times my shoulder pain, if they're not an overhead athlete, we just do like 2 weeks of posture training and we fix our shoulders, which is also probably why I'm bad at the shoulder, is because I'm never treating the shoulder. I'm like
You're always treating
posture,
scapula. Yeah.
posture, posture. And so again, I'm just like, oh, you're an actual overhead athlete. I need you to go see someone else because I'll fix your posture all day long. You know?
I had a kid come in a couple days ago and he was like, I don't know if I can wrestle. Like I'm having pain right on my clavicle and it hurts. And he's got like the shoulders just completely rounded. And he was like, he was gonna wrestle in I think like an hour. And I looked at him and was like, can you lift your arm to your side? He's like, oh, he got just below 9. He's like, I can't, it hurts. And I'm like, now pinch your shoulder blades back and do it again. He's like, whoop, and like bicep hits his ear. And I'm like, go wrestle, pinch your shoulder blades back. Easiest return to play decision ever. I was like, just stop rounding your shoulders. You don't have anywhere to go. There's
Yep.
Right.
there's no space there.
Yep.
So this is the one that I kind of alluded to earlier, Katie. So it is very old. I was 4 years old when this came out. Okay. But in my defense,
why did we have to say that?
In my defense,
what are we doing here, CJ?
In my defense, the position statements for NATA still use the taxonomy sort paper, and that is from, I think, the 90s as well. So that's gonna be my only justification, because I can't really justify taking something that's 30 years old.
I was 8 when it came out, just to clarify.
Still really young. This is an old research paper, because usually you try and find it in the last 10 years. But this was, I actually took this from from another article that had referenced it, so I felt okay. I think that one was from like 2015. So if they're using it, it's good enough for me. So it's Ellenbecker et al. From 1996, and it found that differences between extremities ranged from 11 to 28% amongst a sample with 5 out of 5 manual muscle testing, and that was when they used dynamometry. So they had clinicians test the rotator cuff, and it was 5 out of 5. Strength is good. And then they went and they did dynamometry testing, and they found there was an 11 to 28% difference. So begs the question of, is our 5 out of 5 manual muscle testing for the shoulder good enough? Some might say yes. 11, 28% is clinically relevant, but in sport, we can make up for it. But something to kind of keep in the back of your mind of, maybe for some of these other things, we might want to get a dynamometer and just check it. I know Amy, maybe we'll try and put something in the notes. I know she put something about a cheap dynamometer availability, like $50. But it said that you can make it. And pull up her thing. So she said you can make a easy way to make a cheap dynamometer set under $50. So maybe we'll have her put some info on there. So I think that could be a important tool.
Do either of you use one?
No.
Have you ever?
I used it in clinic. I do not use it in the athletic training.
I haven't either.
Never touched one. We didn't have one in college when I was going through the program, and so I've never used one.
They make there's some pretty good non-expensive options where like you can just, it's like a handheld and they push against it and it just tells you the force. You kind of you got to learn what you're doing a little bit with it first, but I'll tell you, time-wise in the ATF, not ideal.
Hard.
Yeah, if you're in a clinic setting, it's great. But in the ATF, not as great. If you were non-high school, that would be different. But
yeah, or if you're one of those like smaller schools with 400, 500 kids, maybe it's more realistic than a school that's got 1,500. But so we kind of talked about the Y balance upper quarter testing. That one's awesome. A lot of research on there. The outcome measures for the shoulder are quick dash has above 90 for pre-injury, 75 to 89 for re-injury, moderate risk, and below 75 is severe risk of re-injury. I think I did a CU. Again, I couldn't find the research on this because the CU was a couple years old, but I primarily used the quick dash because it showed it was one of the better ones to use. And then Amy put these in here. I'm curious to hear if you guys have heard of them, because I had not heard of them. But Wilson et al. In 2020 used these to assess shoulder function, and it was the closed kinetic chain upper extremity stability test, and then the unilateral seated shot put test. Have you guys heard of those?
The seated shot put test I have.
Okay.
It was on our testing. That was one that Kevin Wilk recommended with his. So I have used it for post-op return to sport testing. I do not use it for most of my just non-operative return to sport shoulder or upper extremity pain athletes. Hopefully that made sense.
Ashley.
I feel like I've heard of them. I couldn't tell you what they are or how to use them.
Yeah, me neither. So they're there.
I could probably screenshot you the process for the shot put test. I think I can screenshot it off of it's like a little clipboard I used to have, so I could screenshot you how to do the test.
And again, the article is Wilson et al. From 2020, so you can always go and pull the references for those tests. But just wanted to throw those out there to let you know they are there, and research has recommended, or they have used it to test shoulder function. So if you're looking for some more testing, that can be some good tests to have in your back pocket. Kurz et al. In 2023 used a couple of the ones that we've already said, but they also used hand grip strength, isometric strength, closed kinetic chain upper extremity stability test, so the same as the one before, wall hop test, functional throwing performance index, and unilateral seated shot put test and isokinetic test. So they use a whole battery. So there's tons of, I guess my point is there's tons of tests that you can throw into your return to play decision making if you feel like you need to. And mainly for those ones where you're kind of like, I'm really not sure. And, or if it's a difficult parent, coach, or you need some more numbers, you need whatever to justify your decision. Those are there. So utilize those. Anything to add to those?
Yeah, I just Googled the closed kinetic chain test, the upper extremity stability one. And I had totally have used it and I didn't even realize what I was doing. Because you're just in push-up position and you have them alternating, touching two strips of tape that are
Oh,
36
I've
inches
done that
apart.
too.
Yeah, I'm sure
Yeah,
you've done
that's
something
what
similar to it.
the Y balance upper extremity is similar
Yeah,
to.
exactly.
Yeah.
There you go. So yeah,
Hmm,
it is just another name for what we've already been doing.
cool. That's awesome. Okay, so last question before we move on to section 2, which 2 and 3 will be significantly shorter, I promise. Do you guys utilize snap counts? I know, Katie, it sounds like you do based on like time, minutes, snap counts, all those things. Sounds like you do. If so, what does that look like? How do you come to that decision, Katie?
Percentage. So you percentage their game time, right? The game is 100% playing time. Defense, offense. Snap counts are hard. They're harder to kind of judge. I go by series, not snap count. Depending offense to defense, that's a lot. But playing time, like, for the basketball, lacrosse, soccer, things like that. It's just a percentage. Like, if what percent are we functioning at? Okay, well, if you're at 75%, we really shouldn't be going 100% of minutes. So, okay, let's
Mm,
take it down type of. I use the coach to help me make these decisions, right? This is not my go-to realm, but it's it's a minutes based on percentage decision. So, like, what's their endurance like? If they're getting winded with me during rehab, like, they don't have the endurance and they're going to fatigue faster, and that sets them up for potential injury in their game. So I got to look at, okay, if they're only able to perform 5 minutes of rehab with me before they're winded, well, if they're going gameplay stage, then they might have 4 minutes. And then things like that, you also have to take into account when you're doing this. Are they going to be able to sub out? And so you got to make your sub decisions quickly as well. But yeah, it's a percentage based option. I don't know that I don't know if I can whittle it down to how to explain every detail of
it's
how
on
I
the
make, you know what I
feels.
mean?
Katie's out
Yeah,
there putting
kind
back in
of.
on the field.
It's like I've watched them perform all of this stuff, so you kind of
Hmm.
you can watch your athlete and know they're getting fatigued and be like, okay, they're going to start breaking down here if we don't get them off the court. I
Yeah, it's
also
experience.
And you build that relationship with them. I've had someone make eye contact with me and just nod, and I just go tap the coach on the shoulder. I like, you got to pull them. And so it's part of that is them knowing their bodies too. A lot of athletes will be good about it and say, I'm fatiguing. I'm not going to help my team here. Some of them just don't like getting beat, and then you got to make that decision. But I mean, we've gone the opposite way where we told some that so they were nervous, they were worried about getting beat, they were worried about what looking bad, whatever it was. And it was kind of one where I actually it's ACL that was nervous to play. Made her suit for the game. She didn't think she was playing because she thought she was worried. She still had that anxiety. So just the last it was, they had the opportunity. We had the discussion before. They had the opportunity with 30 seconds left. A timeout was called and they subbed her for the 30 seconds. And so we used it to build confidence in that way too. Because she wasn't going to say no to her coach, not knowing that her number was getting called that day. So it is on feels, but you got to know your athlete. And again, I don't you probably don't make that judgment call, the first week that you're out of school and starting a new job. But it's built on experience and your comfortability with the coach and making that athlete feel comfortable in what they need. So
Ashley, how about you?
Yeah, so I would also say to those listening who have no idea how to even say, how do I know how many plays this kid can go? Again, it is just like Katie said, you're continually checking in with them and you're going to have that conversation with the coach like, "Hey, let's put him in for a few plays and then pull him out and let me talk to him real quick. Maybe we'll do a quick like strength test on the joint."
great.
Just like for shoulder especially, I'll do like a quick shoulder manual muscle test. "Hey, you're still holding up, you're not breaking, we're still good. How do you feel? You're great. All right, let's go a few more." And then we'll pull them back out and we'll recheck. And it is again a lot about the education on the, I need you to listen to your body and I need you to tell me when something's not right. So yeah, it's,
And
you don't have to know a
situational
number.
awareness. If you see
Mhm.
it,
Yes.
if you've been working with them a long time, and again, I will die on the hill of athletic trainers knowing their athletes and knowing being the best care your athlete can get is you watch them and you go, "Ooh, something's wrong." And you don't know why something's wrong, but I've been that person who went and tapped them and been like, "Hey, I need you to pull this person." And again, good relationship with your coaches, know that like that's not going to go over great with some coaches. But
Mhm.
if you have that trust built up and you go, "Pull that athlete for me," and they sub them off, and then you find out, oh, their ankle was killing them and they were just getting through, and you're like, "Wow, you did a good job of masking that, but get over here and don't do that again." Things like that, where it's just your athlete, you feel it, you see it happen, and you're like, okay. Or and I've been at a lot of games where like, how do you even know? Because that's my job. I am watching. I watch games different. That situation is what your job is. I know we all support our teams, but you're watching the game differently for that reason.
Yeah, I never know the score. I never know how we're doing. I only know how the players look on the field.
I do too. I say
Yeah.
that all to people all the time. What was the score last night?
I
I don't
don't
know,
know.
but we had
Yeah.
3 injuries. Like,
Yeah. And if you have a good relationship with your coach, a lot of times they'll tell you first, like,
Yeah.
"Hey,
right,
Johnny just got beat on these 3-1s. He's hurting. I'm pulling him out." And you're like, "Oh,
right.
I looked away for 2 minutes. I didn't even see that." Like,
Yeah.
how he looks with those. He should be able to cover that.
Yeah.
But what you said with the coaches is massive because you do have to have a great relationship. You have to educate. I've been in the position where I've said like, "Hey, we're going to do like this, and this," whether it's minutes or whether it's, "Hey, he can't hit, but he can do this for baseball." And the coaches are like, "Well, you said he can do one thing, so he's doing everything." And that can get you in trouble really, really fast. Ash.
Yeah. If you do not have that relationship with your coaches, you do have to err on the side of caution. And if I know my coach is just going to play them 100%, they're not going to let me pull them, then I'm not even going to let them play.
Mm-hmm.
Um, and so I will make sure with the coaches who are a little less cooperative, I make sure that those are the ones that I hold out maybe a little bit longer because
You
I
can't
don't want
guarantee
to.
that you're going to protect
Right.
them.
Well,
Yes.
and
Yeah.
flip side, if you know your coaches, I I cleared a kid. I said, I want trash time minutes. I lovingly trash time minutes, and said, and they came in maybe 10 minutes later and they're like, "Katie, he's starting." And I was like, "I'm aware. You guys are jerks, but I'm aware. I know how you coach. I knew I lost that battle before I even said he could play." He was ready for all 16 minutes of a half before I cleared him because I knew they had been on me for 2 weeks. "He can play. He can play. He can play." And I had been saying, "No, he can't play. No, he can't play." So then when I went in that day and I said, "Okay, I'm going to allow trash time minutes today." And then I knew because it was an away game. I went to the away game just to be clear. I knew how this was going to go because I knew the coach, and it was a very respectful relationship with the coach. But I knew as soon as I said he can play, they're like, "If he can play 2 minutes, why does it matter when his 2 minutes occur?"
It's like that fatigue isn't a word for them.
Right.
It's
Well,
kind of
but
funny.
and in their minds, and I'll give them credit because they did think it through. They were like, "Well, why would we have him warm up and then sit for 6 minutes before we give him his 2 minutes?" And I was like, I get it. What I
Oh, was he
really
just 2 minutes at the beginning of the game, not the whole game?
well, I needed him to get on the court because he hadn't been on the court in 12 weeks or so. It was a whole situation. He sprained, it was like his fourth sprain, really bad sprain in 4 years, and the athletic trainer on site told him he needed to be on crutches and maybe wasn't going to play basketball anymore that season. And then the doctor told him he was done playing basketball for the rest of his life. So then I had to argue with the doctor that that's not a realistic expectation. So because then we went through the depression stage of I can't ever play again. And I was like, this is unrealistic. You are absolutely, you're 6'5". You're going to play basketball again at some point in your life. So I need you to come out of this depression to do your rehab. But he wouldn't because the doctor wasn't going to clear him. So then I had to call the doctor and have a very real conversation with the doctor about how you can't ever tell someone they'll never play again, because realistically, organized sport versus unorganized sport, this is a 18-year-old who is going to go play intramurals in college, whether you approve of it or not. So please give me guidelines that would allow you to clear him for sport. And it was a very, very long, detailed process of this rehab that came down to, oh, he ended up playing the last 6 games of the season plus postseason after being told he would never play basketball again. And we had to jump through hoops to get him there.
Nice.
I just needed a confidence builder. You guys, I got stories for days.
Yeah, and I've also, particularly for football, I've also used the sideline official before the game or right before the game's going to start, because sometimes you don't know who that's going to be till that point. I go up to them, I say who I am, and I was like, hey, I'm watching this player. I don't trust necessarily that my coaches are going to let me take him out. If I let you know, will you stop the game and help me pull him out? And they'll be like, yep, got you. Or maybe they won't, but I try to at least have that conversation, and you can kind of suss it out. And I've done that in more severe cases.
Mm-hmm. Yeah, I had a pretty severe one where, well, I won't get into it, but yeah, I've had a more severe one where I had to have the refs kind of like be my backup if I needed
Yeah.
it. Luckily, I didn't, but it's not a bad option to have in the back of your mind. But again, circle back around and
I mean,
educate.
if you don't have an option, walk yourself onto the field. Aside from rugby,
I've done
play
that
will
too.
stop.
That is your job. That is
Yep.
your
It
job.
is your job, and
Yeah.
you can do it. Aside from rugby, play stops. So
Yeah.
walk yourself right out there and just stand there. They'll stop.
Yeah, be like,
It's
hey,
not
there's
the
somebody that
best
could
option.
seriously
I'll
injure.
tell you,
Yeah.
you probably won't make a lot of friends, but
Nope.
but
At
but
that
if
point, you've
you
probably exhausted every other
and
option.
and if you have the concern, again, it's your job.
Mm.
If you have legitimate concern that you are taking that step, I would
And
not do
yeah.
it to just not make friends, but it is your job, and
Yeah.
and you have to protect that player.
And I would probably only do that for a head
Yeah.
injury, but yes.
Yes.
But I have done that where I was like, oh no, I saw that hit. That kid can't be on the field anymore. And like no one was listening to me, and I just walked out on the field and I was like, stop. Like
I
with my
had a
arms up.
kid who he like got hit late on the ground, hit to the head, and then
Yeah.
I went to talk to him and he just flipped out. He screamed at me
Yep.
through his arm, like almost hit me.
Yep.
And then coach was like, "You good?" He goes, "Yeah." And he runs back on. I'm like, "No."
No.
So I had to go to the ref. I'm like, "Nope, stop it. He is
Yep.
not going on. He has not said a word to me. He just showed clear
Yep.
signs of possible. I need to look at him." And the coach was not super happy. But I'm like, dude, you just like, I'm looking out for the safety of the kid. You have to do what you need to do at the end of the day.
Yep.
So this goes in perfectly. Sorry, Ash, did you have one more thing to add?
I was gonna say in football, I have carried a bike lock to lock up helmets before.
Yep, same
I
thing.
love it.
I have a bike lock. I lock
Yep.
him to my table. Good luck getting
Yep.
it back. But
Yep.
because I used to carry him around the sideline, and my team doctor bought me a bike lock because he thought it was crazy.
I love it.
So just to be
That's
clear,
fantastic.
yes, I have walked myself up and down the sideline holding football helmets. But
Yep. Oh, me
bike
too.
lock is a great answer to that, you guys. We're here
Oh, I love
from
it.
experience to tell you the tricks. Buy yourself
Yeah.
a bike lock.
I can't believe your team physician bought you one. That's so funny. Oh, I love it.
You know who it is too.
I
It was
do.
like
I
2
do.
weeks after I met him.
Love it. We got to get him on here. Okay, so that kind of segues perfectly into what this decision looks like on the sideline, because it's going to look vastly different. You have almost no time. We're going to, just to kind of put this in there first, we're not going to talk about wrestling because that's going to be in section 3 because it's a special consideration. You only have a small amount of time. Like officially a small amount of time, even though for all the other sports you still have a small amount of time. But so how do you handle that truncated return to play decision, Ashley, when you have an acute injury? Let's say it's wherever in the game, even if it's like in the fourth quarter, and they're like, hey, we need him to go. Can he go? And the kid's like, can I go? And you're like, hold on, I need to figure this out. How do you navigate that?
Quick range of motion, quick strength test. That will usually show you everything you need to know. Usually. And then seeing how they feel. And again, that's a judgment on how well do I know this kid? How well do I trust this kid to tell me the truth? That kind of thing. How well can I read it when they're lying to me? All of
Mhm.
those will go into that decision. But yeah, super quick on the field. It's a range of motion. If you can't pass my quick strength tests, you're not going in until you can.
Yeah,
Um,
special tests, break tests.
yep,
What in your mind you're going differential diagnosis? What's the worst case scenario? What is the possible outcome of the worst case scenario? What is am I making a life threatening or a life altering decision today?
yep,
No, okay,
yeah,
and then and go through. It's the same as it's just a really sped up evaluation where
yeah,
you go, okay, what am I ruling out first? Okay, have I ruled out all of the really bad stuff?
yep,
And then
yeah.
can
And
go into
then
another world. But
yeah, lower extremity, usually those quick functional
mhm,
tests, jog a line, do a cut, do a
right,
hop, you
Mhm.
good, do a squat, you can do that.
right.
All right, go ahead.
Yeah, I
Like,
saw what
Yeah.
I need to see to get you back
Perform the
on.
maneuver that you have to do and perform it at
yes,
100%. And if you
yes,
can't, why am I going to let you go at 100%?
exactly.
Do you allow if they can go 85%, 90%, do you allow them to get back
Uh,
on?
I feel like it depends on
Depends
the
what they're
sport and
doing.
the position. Yeah, it depends.
Let's say football, ankle injury,
Are they a lineman
85%.
or a
Wide receiver.
Then no, probably not.
Even if so let's say cutting is but they can go 85% in a straight line, and that's faster than a lot of other people.
what player are they and what point
Uh,
in the season is it?
yeah, yeah, yeah.
Are
See,
we
this
in
is so
the
fun to
At
get
what
in the
semifinals?
point in the
weeds.
season?
Are we in the semifinals and do I need him to run a post route? Like you guys,
Yeah,
what is
yeah,
the goal? If he's going to run a post route and all he has to do is get tackled, sure. Like
yes, yes.
I don't
Agreed.
listen, you got again make friends with your coaches and know your sport.
Yes,
I've spent a lot of
Mhm.
yes,
year on the sideline. I know a lot about a lot of different sports. If they're a soccer player and I just need them to make a touch, I in college I had a 3-time same knee tear ACL. You know what we used her
Oh.
for? She subbed on to throw the ball in on an out of bounds play because she could overhead throw the ball better than anyone else on the team could. And then she could run straight lines. So she
yeah.
was cleared to run straight lines, but she sure subbed into the soccer game so she could throw the ball in because it was like a corner kick.
That's
So
funny. Yeah.
again, know the situation. It's not an easy thing to learn. It's years of
No.
By the
experience that
way,
builds to that.
that's crazy when you see that. When you see those
Yeah,
corner
it's
when it
wild.
throws that are like a corner kick is I'm like, "Oh my goodness."
Yep.
But
It's awesome.
again, ankle, knee, are we semifinals? And do I have my team doctor there to help me make a decision? Because if if they can run a straight line faster than anybody else, we might be using them. I I am the biggest fan of the team I am helping, and my job is to keep them safely on the field. Can they safely perform this task without doing further damage to themselves or
Mhm.
their living capabilities later in life? I'm gonna make that decision based on a lot of things, but usually I'm saying you got a lot of years left, you got a lot of games left, there's a long season ahead of you. We're pulling you from this game for all of those reasons.
Yeah.
However,
Versus this is your last senior game. Go have a
right,
hoorah. you
right.
Right,
might
right.
you might need
Have I
surgery after,
Pick up
but
the
multiple
pieces
times
after.
allowed
yeah.
someone to stand on the corner of a soccer field for senior day and they start the game and then they sub off because we ask the other team to kick the ball out of bounds or we happily kick the ball out of bounds so
Yeah.
that they can do that? Yeah, 100%. So it's all situational dependent, but I let a fifth metatarsal fracture go back into a game before. Yeah, I did
Yeah.
because he could
Yep.
perform on it and he was better than the next guy up, and it was a semifinal game.
Yep.
I I also immediately explained to the parents, "Hey, this is a real possibility," and got their consent for it in the
Yep.
same breath
Mhm.
because this is a real possibility. The chances are he's having surgery after I let him do this. That he probably was having surgery before I let him do
Yeah.
it too.
Yeah.
But just know I need you to say yes to me making this decision, and then I'm going to protect him as best I can.
Yep.
However, I also know that those type of things matter later in life, that you can say like, "Hey, I did this for my team."
Yeah, and that's the reason I brought it up is just to show, especially for those early emerging professionals, there's what the book says and there's what actually happens in real life.
To be
And
clear, I've also got it wrong. Like
Mhm.
For
just to
sure.
throw that out there for
We
Well,
everybody.
all
that's how you
do.
get experience. You
I
make decisions that are not correct.
100% have been on the side of and I think it's a detriment we all have. Everybody wants them playing. So you don't want to believe that you're testing what you're testing. And so
Mm-hmm.
have I made a call where I was like, feels solid to me. And then it ended up not being, yeah. And I felt really bad about it later. So there are those situations. And as soon as you see or realize your mistake, because if they try to cut on a torn ACL and then they can't, they're coming right back off the field with you. And you feel really bad about it. But sometimes you're wrong. Try not
It's
to
gonna
be
happen.
wrong.
Yeah. Yeah. It's gonna
Try to err
happen.
on the side of caution because
And there,
you learn from mistakes, and I have made that mistake.
there's every return to play decision on the sideline is going to go somewhere between you cannot go to it's stable. We can go, but we might pay the price after the game. You might need surgery. You might be out for 4 days after this with more pain because we made it worse, but you don't have a game until 7 days from now. So we're accepting that. To you can go back in fully, and it's going to fall somewhere in that range. So I think especially for those early emerging professionals, understand that it's never going to be super easy, super clear cut.
Not black and white, that's for
Yeah, just do
sure.
the best you can. And like Katie said, roll out all the big bad stuff and then understand it's a fluid. Just because you looked at them, you put them back in does not mean you can't pull them 10 minutes later because you're like, this is not looking right. I'm not comfortable with this. Thinking about it more and then looking at them, you're like, their ability to play is he's at way too high of risk of participating for further injury. So I'm going to pull him now. It's a fluid decision. So it's not a one and done. What are some red flags, Ashley, that you see every time that you're like, yeah, nope, you're not going, you're done?
I mean, your basics, they can't even walk or run on it, lower extremity, right? Um, can't do a basic task with that limb. Again, it's basic range of motion, basic strength. Have we passed those? Oh, and then nerve, any nervy stuff happening, then we're probably not going.
Nerves is a
Um,
big one for me. Yeah.
Nerve's a
Like,
big
nope,
one.
you're done.
Yeah, numbness, tingling, burning that shouldn't be burning. Like it's not from the icy hot or something. Like I have had that once where a kid was like, "My arm is burning," and I was like, "Oh, I was feeling it," and I touched it, and I was like, "Did you put like icy hot or something on this?" And like, "Yeah," and I was like, "Well, that's what's burning,
The hot part's
silly."
You
kicked
did
in.
that to yourself.
Yeah. So I had to like wipe it off with like hand sanitizer, stuff like that. But so yeah, you rule out the big things. The nerves are good, circulation is good. There's obviously nothing out of place. You
Right.
go play.
I was gonna say crepitus is a big one for me. I'm like, oh,
Oh
that
yeah.
that isn't supposed to move.
Nope.
That felt yucky, is what
Mhm.
that felt like. Gross swelling, any gross amount of swelling or edema or
Yeah.
uh, ecchymosis, all of those. Immediate bruising that is significant, right? Things that show
Yeah.
like, oh, this is more severe than it is. But yeah, and I think again, knowing what that's supposed to feel like too, where you're like, why this doesn't feel right.
Mhm.
And like for sure, palpate, please. I it needs to be said because even experienced people like they check range of motion and kids
Totally do.
sometimes are good at masking. And then you're like, sure, you had full range of motion, but your clavicle's in two pieces. Like, how'd you move? How'd you do that?
Yeah, we've all seen
like,
that. It's like, how did you just do that? I had a kid
right,
who tore his ACL. I put him, and he was making me question myself. I was like,
right.
it's gone. And he said, oh,
Yeah.
I feel fine. I feel fine. I'm like, well, this is weird. And so I started putting him through return to play testing. He got all the way to jumping, single leg jumping. I had him do a single leg jump. He got about an inch off the ground. So I told him to pretend like he was an athlete. He jumped, immediately landed, face went red, collapsed to the ground, went, "Roar!" I'm like, so you can't play.
Right. And then Ottawa ankle rules, right? You hit those and you're like, oh, these are, I mean, usually they're having trouble walking and performing on it too. But the again, gross swelling inhibits muscle function. And so if you can't, if you've got inhibited muscle function, you're going to have problems. So for me, if I've got any swelling on the knee that looks it, bursitis is hard to guess on an acute injury
Mhm.
evaluation. So you got to protect the quad to function because your ACL is underneath of there. And so sometimes that'll be my biggest thing where I'm like, I don't know why you're so swollen. Hopefully it's this. And especially if you can't get a good test, if you can't perform your special tests, then you probably shouldn't be putting them on the field. Like
Yeah, if you're
if
flying
they're,
blind.
yeah. So I think that's a big piece of it. But know the Ottawa ankle rules. I think there's Ottawa knee rules. I don't use those
There
ones,
are.
so but knowing those and using those as your judgment. But yeah, I've multiple times felt crepitus, and somebody was like, "Oh no, they're good," and I'm like, "No, nope, nope." And then again, palpate because don't miss a broken clavicle because that seems to be more common than it should be.
Yeah, we've had a lot this year.
I know
Um,
their pads can hide it, but please put
They
your hands
can.
yeah.
put your hands in their stinky, gross pads so you can feel
Blech.
it. I'm sorry. It just is. You signed up
It's
for
part of
this.
your job. Yeah, you know what you're
Yeah,
getting into. And
hockey
I will
pads.
say back to that, like, oh god, hockey and lacrosse. Oh, you can smell like 20 minutes after
I
they've
can
been in the
smell it
gym.
right now, and I'm no.
Yeah.
It's ingrained in my brain. We just said the words.
Oh, what was I gonna say? Oh yeah, the fluidity of this decision. So if you're not sure and you're like, I don't want to pull them because this could end up being like nothing, but they could be feeling a lot better in a quarter. Wait, I can't tell you how many times we've been early in the second quarter and somebody gets hurt, and I tell coach like, hey, here's what I'm thinking it is. I'm worried it's a little like it might be this, but it could be this. One would hold them out, one they can go back. And I'm like, we're gonna see how it progresses in the next 10 minutes, and then I'll have some more information for you. I'm hoping it's not this. If they progress the way I expect them to, then we can rule that out and we can get rolling. So wait. I do that a lot of times with head injuries. I'm like, we're gonna
I think
wait for
that's really important for high school athletes.
yeah, because they freak out and they're like, hey, pain's an 8 out of 10. They can't move it. They might just be scared. Let's have them walk to the
Right.
locker room at half, walk
If
back
you
out, and
have
then
not
see what
had
it
a
feels like.
9 out of 10 ankle sprain that became a 2 out of 10 within 10 minutes, then I don't think you've been a high school athletic trainer for very long. Like, all it's like screaming, rolling, and then 10 minutes later, they're like, "I think I can play." And you're like, "Drama
But if you make that
queen."
decision, hey, it's 9
Yes.
out of 10,
Yeah.
you can't move it. I'm pulling them from the game.
Right.
You're not unringing that bell because you're going to lose a lot of credibility. So
Right.
don't feel like you have to make that decision immediately, unless it's something like, hey, I felt laxity in the knee. Where,
Yes, and I think
yeah,
important go back to that as the concussion discussion as well, because, you were about to talk about it, but
yeah,
same,
yeah.
like, every hit to the head can cause a headache. They don't all cause concussion, but we do have to err on the side as if they are, but
Mhm.
then if you do all your testing and they're fine, you gotta give them that time to calm themselves down. Because again, I love them dearly, but our high school athletes are drama queens sometimes, and they just make a big scene out of it, and then suddenly they're like, "Oh, actually, I'm fine."
Mhm. Or the other way. Hey, I felt
Right,
fine, but now I'm having symptoms coming down
right,
15 minutes later. You're like, oh, I'm glad I didn't put you in, even though you cleared
right,
everything.
right.
So, all right, last point, and then we'll quickly go through section three. Ashley, I'm going to start with you because I already have a feeling of how Katie's going to answer. She's kind of already alluded to it. Um, when you're on the sideline, and I already know the answer to everyone because it's the answer to all of athletic training. It depends. How does that discussion go with the athletes and coaches mid game? Do you bring the parents into the discussion? Do you bring the coaches in, or are you kind of unilaterally, for the most part, making that decision because it's a time crunch?
If it's a more mild injury, I can absolutely unilaterally make that decision, right? It's an easy yes, no. Oh, it's easy yes. Okay, yeah, go ahead. You're good. Um, During a game, I very rarely let the coach be involved in that decision. Um, because they're usually so busy doing their job. Like they don't have time
Mm-hmm.
for that either, unless it's like a halftime discussion, maybe. And then parents, yes, if parents are there and this is something where I'm teetering, I will ask the parents for their consent. Be like, hey, I think they can go. Are you comfortable with that? Then yes, great. If not, then no, because some parents are very conservative and they freak out. They're like, no, okay. You're like, okay, great. My decision's made. So if possible, I do love getting the parents' decision and their opinion, and I educate and they usually can take that matter out of your hands and they can take that pressure off of you from the coach. Be like, nah, their parents said no. And they're the boss. So but yes, during a game field side, the coach is almost never making that decision with.
Katie?
It depends on the coach, but yeah,
Mm-hmm.
I regularly they just wanna if some teams I've had some teams where it's not the head coach, it's an assistant who just but most of the time, it's not a discussion, it's a yes or no. They have you ever had a football coach do one of these? to
Yep.
you.
Oh
Yep.
yeah.
And they
The
just
pull
want
in the
yeah,
microphone,
yep.
their
They
earpiece
pull
out.
their
Yeah.
earpiece out and they go yes or no. And you
Yeah.
just and it's a one-word discussion. It's not even a
Mhm.
Yes.
discussion at that point. So
Yeah.
no, they're not participating in the decision making. They want to know can they or can't they. They don't want to know the details. After the game, they want to know the details. What happened? And sometimes they kind of pulled themselves. They just weren't going to do it for you.
Yeah.
But they don't want to know that in the middle of their game. They want to
Mm.
know who they've got on their depth chart to go. The depth chart.
The
That was
chart.
rough. The chart thing, the thing. But that's all they want to know. And the same assistant coaches will do it too. They just like thumbs up, thumbs down, like which way.
Mhm.
And that's all they want to know. When I make the decision for the other team, if I come down and it's just they went down on the court, but it ended up just being a bruise, they just needed their minute or whatever. I regularly, away teams will just tap the coach on the back and say, hey, they're good, they can go, and keep walking. I don't
Mhm.
stop to have that conversation because they don't want it. They don't want a multiple minute conversation. It's a yes or no. Can they go or not? Other sports, yeah, we've had the discussion halftime, quarter, whatever, or we've had the discussion pregame, or they something they got to know if it's major. I've had to have that conversation mid game, not intentionally, but they're like, it's just a bruise, right? And it's like, it's not just a bruise. And so then it requires a little more detail because when you go up and you say no, they can't go, they look at you like you have three heads because they didn't know what the injury possibility was. So I think that but yeah, it's a yes or no. Thumbs up, thumbs down. What are we doing right now? Thumbs down.
That relaying is a
Yeah.
skill.
Mhm. Yeah. And I would say I feel like this more so with soccer is I might say, yeah, but they're probably not going to be 100% for you. And then oftentimes I'll be like, yeah, I think they could probably go. They're not going to be great. And then the coach will just be like, no, we'll sit them because
Mhm.
they also know their strategy. They know what games they need them for next, etc. So a lot of times the coach will make that decision and not let them go. So
Right.
Mhm.
I think the only ones where it's more involved is if you are putting them back, but you're testing them. Like if you're testing a run down a sideline and a cutting, you'll see an assistant coach's head turn to watch what you're doing
Oh yeah.
because they got to know too. And
yep.
they don't know for sure what you're looking for, but they know what they're looking for as far as performance goes. So if you're doing it, maybe grab an assistant coach. Hey, watch them because I'm thinking about putting them back in if you can. Again, experience matters with that. If your coach sees them doing that and they kind of know, you'll see the heads turn. But again, it's sport dependent. I think that's more soccer than
Mhm.
anything else. They got to see them.
Agreed.
Cleared
Yep.
versus effective is two very different things.
Hockey's a hard one. How do you tell if they can skate? I until
Mhm.
I
it's
haven't worked enough
Hockey, the
hockey.
culture is tough too
it
because it's
is
very much like tough it out. That
right.
one's tough to get a good
Well, and to
idea.
get them skating again versus,
Mhm.
if it's a lower extremity and they have to like it's tough. Some sports are tougher than others. I think the higher risk, the higher contact, the higher collision, like your decision is changing based on their expectations.
Yeah. And how much of
Yeah.
the sport's in your hands? Like,
Yeah,
if are you just gonna get rolled up on or hit randomly and injure this, or can you
right.
somewhat protect it as much as you can
Yeah.
in sport?
What if the exact same thing happens again? How frequently does the exact same
Mhm.
mechanism occur? It totally matters.
Yeah. Yeah. Any final thoughts on return to playoff from the sideline?
Know your equipment too.
Yeah. No, yes. All right, so that'll wrap it up for section 2. We'll quickly get into section 3, which is special considerations, and we'll kind of keep this part short. We only have a couple things to talk about. But the first one I mentioned at the start of section 2, and it's wrestling. I wanted to keep this one separate because it's kind of its own beast. You have 2-minute injury clock, unless it's a head injury, which you now have 5 minutes, right? They extended it, I think, for Colorado.
Yeah, head time is 5 minutes.
5 minutes. Okay. So we're going to start with soft tissue evaluation because we have a whole spiel to go off on the concussion evaluation, how we do that. But we're talking about in meet. So when this happens, like during a match, what is your process? How does it look different from a sideline? Because you got a lot less time. I mean, largely it's going to be the same, right? Strength, range of motion, but we all know that there's that time factor that, this is going to feel a lot better in 3-4 minutes. So how do you navigate that? They don't get that. So how do you navigate that, Ashley?
It's all of are you good to go? you
Done. All right, we're
is
gonna move on
anything out
then.
of place? Is anything out of place? Do they have full range of motion? Do they have at least close to full strength? Do you think you can keep going? If not, We need to know now. And maybe sometimes they'll do a couple quick moves to see how they're doing and they'll test it out. And then I let them make that decision. If there's nothing on my end that I'm immediately like, oh, that's broken, then yeah, it's are you good or are you not? This is your choice. And sometimes they'll say yes. And then very quickly, like they'll start to wrestle again and be like, nope, I'm out. So I let them make their choices.
It's tough because there's that chance, like Katie said, is this going to happen again? And if it does, this could get a lot worse. But what are the odds that it does? And what are the odds? I always like when I do one and I'm kind of like, I'd really prefer if you didn't, but you're telling me you can go. You're showing me you can go. I'm like, but I don't. And then they go and they pin them within 10 seconds. I'm like, cool,
Yep.
not nervous anymore. I can
Yep.
move on.
Yeah. Great. That
Thank you
solved
for
that.
ending that. Katie, what does it look like on your end?
Yeah, same. I am classically at wrestling going, okay, you have this much time left. Can you go? Use your time. You have a whole 2 minutes. Use your time. Breathe, catch your breath. Okay, tell me what it is. And then in my head, differential diagnosis, how bad is it? How much worse could they make it? But and then again, palpate, make sure nothing's broken. Do your fracture tests. Rule out anything getting worse. But can you go or not? And then we're going to decide afterwards because the major ones, they can't go. You know, if you have deformity, if you have dislocation, if you have fracture, they can't go. They know they can't go. Chances are their pain level is already there. Chances are everyone else in the gym already knows they can't go. Head injuries are harder. I agree. I cannot find the form right now, but we will find it. We will attach it. Colorado Hall of Fame athletic trainer Sean Carmody has drawn this up. I think we can share it. If not, we'll double check that with Sage and sorry, Amy. But we but that's a different conversation where I got to do a more detailed thing. But I will do a quick special test and go, can you go or not? And I've had a coach come get in my face afterwards about it. And I go, I'm sorry, if you don't know your sport as well as I do, that's fine. But he can either go or he can't. And if you as a coach don't think he can go, then make that decision. Why are you making me make
That's
it?
fascinating. So it's usually the other end. I usually have kids who I'm like, you clearly can't go. And I'm like, what do you think? Do you think you can go? And they're like, I don't know. I'm like, you can't lift your arm. You can't. And I turn to coach. I'm like,
Right.
he doesn't want to
So
say he
this
can't
sport
go.
or this podcast has somehow become me saying know your coaches, know your players a lot of the time with this. Because in the sport of wrestling, can they go or can't they go? If a coach doesn't think they go, the coach should be saying that.
Mhm.
But as far as I'm concerned, are they functionally able to continue because they need their to be in their ATP like collagen stage of performance for a minute and a half more of the match because they probably didn't get hurt at second number 1. So they need to be able to perform for 120 seconds, which is their ATP and their glycogen stores. They just have to be able to do fast activity or they're just going to stall the rest of the time. But know your sport, know what the sport of wrestling entails. Are they going to get hurt further with this or not? But also, your coaches should be able to make that decision. And if they're not protecting their athlete either. Because I've had the first weekend, I mean this so sincerely, the first year that girls wrestling was sanctioned in the state of Colorado, we hosted the first weekend tournament, and I swear I spent 2 minutes with every girl in that tournament. We used their
Mhm.
whole injury time, and
It's
we just
tough.
got through it. But then again, don't come to me and again, know your sport. You are going to make someone mad. If you medically disqualify someone from a match and they have to forfeit because of the injury, if you
And then they
don't know
end
what
up
I'm
feeling
talking
fine in an hour.
right, and you don't know what I'm talking about, I I've actively been there and had a coach get in my face because it affected the team score. I get it. I've looked at them and been like, I didn't have a choice. It's not, I don't care about your team score. I don't care about the rest of the day today. I care about this athlete right here. And he is medically disqualified because your kid sumo threw him onto the mat. Like, you can't, I, yeah, it was an illegal move, coach. Sorry. Like, I've covered a lot of wrestling to say the least. You cannot, I, I have walked onto a match and been like, are you kidding? Blow your whistle because they threw someone, they pile drived him. Like, this is not WWE. This is high school wrestling. Do not blow your whistle and stop that from happening. But again, then the kid who did the pile driving is forfeits the match and he loses because he did an illegal move that got someone hurt. Know when you make that decision. It's not against anyone else, but know that going into it. So when someone comes to get in your face about making your decision, you can say, no, no, it has nothing to do with the team score, because I don't know why anyone thinks that we're out to get a
We don't
team.
even ever know the team
I'm not a
score.
home team athletic trainer. Nobody cares about that in the athletic training realm. But for some reason, people think that matters to us. I Sorry, your player did a dangerous move and it got him disqualified. That's not my fault. But I think that matters. But use your time, use it effectively, and sometimes know what your decision is gonna cause, I think is
Hmm.
important too. Um,
Yeah.
it shouldn't matter, but it does, and just know that it might happen.
All right, let's dive a little bit into the concussion evaluation part of this. I think this is one of the hardest things we have to do in our job. Just this specifically, concussions for wrestling. It is so difficult. And I've had the whole spectrum where a kid head to head, we take the entire time. I run him through the gamut. I usually do upper quarter, lower quarter. We'll get in this with Sean's too, but upper quarter, lower quarter. I do quick cranial nerve testing. I ask him verbally about a lot of the symptoms. And then I have them do functional performance testing. And if nothing's flaring up, and I'm like, oh, okay, like I keep an eye on them and I stay by that mat and keep an eye on them. But I've also had the other end. So I've had that happen when they actually come back like an hour later. Yeah, I'm not feeling good. I'm like, oh, dang it. I just put a kid back on who had a concussion, but he showed nothing, which every single athletic trainer who's ever practiced has put somebody back into a game who had a concussion, whether they knew it or not. It is almost impossible if they're not showing any symptoms at that point to not have it happen, right? But I've also had the other end where I love this kid to death. He walked up to me and his face was just one eye shut, one eye open, looked like he had just come off a bender, and he was just like, my coach just said, I think they think I might have a concussion. I looked up, I was like, oh God, this is a bad one. No concussion. It's just his face. So I told him next time, I was like, you can't have that face on when you walk in to see me and say that. It's totally fine. And I deferred to the next day, and I was like, my colleague, I was like, hey, can you take a look at him? He said this, but he came in looking like this. He's got nothing. Like he's got a little headache because they hit head to head, but nothing else. Like, can you take a look at him in the next 24 hours? I already called his mom. Everyone's aware. We're keeping an eye on him. He came back. He was fine. Didn't have one. But so that one was, I looked at him and was like, you are concussed. Wasn't. The other kid, I think you're good. Concussed. So this is the hardest thing we have to deal with, I think. So, Katie, how do you manage it?
It just comes down to knowing your athletes. If I don't know them, it's a lot. I you know I It's easy for me to say no. Listen, I don't know you, but you have the symptoms, and state law mandates that I pull you if you have a symptom, and maybe you'll be fine next week. I'm happy to tell them. I'll text the athletic trainer at their school again. Go back. We know we have a list. Come see me. We'll get you the list. But I'll text their athletic trainer and say, hey, I had to remove him for a potential head injury. Told him to come see you on Monday for reevaluation. This is what they have going on. I'm going to check on them again in 15 minutes or 5 minutes, depending on the situation, and see how they're doing. But as far as continuing that match, it was a no, and that disqualifies them for the day, and it is what it is. But if I don't know you and you're acting weird, like I get and I listen, kids get upset. They don't want to talk to me. I get it. Like high schoolers are high schoolers are high schoolers. If you have been in the high school realm, you've seen the behavioral changes that they all make. Some of them are angry. You got to get them to calm down. I've looked at someone and said, "Hey, I have to make a decision on how you're acting right now. Act nice to me so that I can make a good decision. Stop get over here, stop pacing, calm down and talk to
Anger is
me."
a concussion symptom.
Right. Yeah.
Irritability.
And so and I tell him that. I'm like, "Hey, this builds into my decision making. I have to say you can go. You can't say you can go. Calm down and talk to me so that we can make this decision. I'm not here to hold you out. I'm here to say if you can go. But if you're going to act like that, I can't say yes. So calm down, take a breath. Let's talk about it so that I can say yes or no. But don't just go off the deep end. Come back, act like a normal human and have a conversation with me." A lot of times they calm down, or if they snap at me, I'm like, "Hey, I'll just say no right now. and snap back, and then they kind of, their brain triggers and they relax and get polite again. Sometimes, and coaches will yell at them sometimes too. It's all situational, but it's education, sometimes in a mean tone, that says, hey, we have to do this regardless of how you feel. We have to do this, so we're going to do it right. And a lot of, I'll tell you, a lot of referees are a little bit lenient about it, like they'll see it and they know what you have to do, and so they'll give you an extra second or so, but they'll be like, we need a decision, and then 30 seconds, we need a decision. And so know when you're being given leeway to make a decision. But if you're fully past your time and you still haven't decided, your answer is probably no.
And sometimes they give you like that first minute of the injury time, and then they look at
Yeah,
you and like, do you need head injury time? So you get
right.
an extra minute,
Right,
which is
and you
nice.
do have to request that time. You
Yeah.
can't, like, if you go out for an injury, like, I've seen an injury and walked onto the mat and just said, "Just start the head time now," because I don't want, maybe they're gonna go again, but I know I need the full 5 minutes. I don't like to waste their injury time, um, but also, if you need 7 minutes, you're probably already disqualifying them.
Well, and if it's third period,
Right, yeah, then whatever, use your whole
you
time.
use it. Yeah.
But, yeah, I think again, just the more you work with high school athletes, the more you realize they're all very similar. That was whew. But they're all very similar, and you can make your decisions based on what looks normal to you. Head injury wise, I regularly am a behavior watcher. Like, if they have a full personality when I start talking to them, like they're making jokes, they're quick witted, and I'm talking to them,
Hmm.
I'm pretty confident in letting them go again, because their personality is intact. And I tell parents that a lot. I'm like, listen, intact personality matters. And so if your kid is not acting like your kid, you should be concerned. But if this is your kid's normal and they're snarky and quick with me, I'm like, oh, I feel comfortable letting you go.
Hmm.
And so I think it's knowing that part of it too. Um, I don't know. Hopefully that helps.
I'll kind of expand to you, Ashley. Like, let's say we got a kid who gets up and head to head, they get up, they kind of stagger for a second, and then they're fine. They clear everything. Coach is like, seems normal. Everything's normal. What does that look like for you? Are you looking for that one moment, or do you kind of take that whole evaluation into consideration?
I'd take the whole evaluation, but then for wrestling, like if that were the case, I would probably let them keep going, but keep a very close eye on them. And then immediately after that match, we're doing a full eval again, and we're gonna do a recheck and make sure. And as long as they're still doing great, then awesome. Some kids are just weird and they do that head shake all the time and they're fine, so and then I'm never afraid to ask a coach if it's a kid I don't know, it's not one of my athletes. I'm like, "Hey, is he normal? Is this normal for
I
him?"
do that all the
And
time.
it's usually for the kids that are, like, not answering or answering a little slowly, and I'm like, "Coach, is this kid always this dumb?" Like
Where they
like
where they quiz them, like, if he does this to you, what do you do? I had that do that last. I was like, this is awesome. He just
Yeah,
quizzed him on like what he's gonna do. He's like, he seems like he's responding quickly,
yeah.
like he normally does.
And yeah, so and then, if I really don't know and that kid is being uncooperative, it's just a no. And it's you're going to learn the consequences of your own actions really quickly.
Hmm.
So it's a teaching moment either way. We got to err on the caution of let's save this kid's life. So that's our
Yeah. So to finish out the section, Katie, do you want to run through that concussion evaluation that Sean has? Do you have that available?
I'm trying to find it still. Hold on. I'm pretty sure
Oh
I
my
have it.
goodness.
I'm like right on it. I just haven't got to it yet. I'm sorry.
How many of you have had a parent say to you during a concussion eval, "Oh, my kid's always that stupid."
Yep. I
That's
actually
my
tell them
favorite.
as a joke at the end. I say, if they're vomiting, they won't stop, they can't wake up, and all that stuff. And I say, if they start acting normal, take them to the emergency room. And I always get
They
a
always
laugh out of that
giggle,
one.
yeah.
Except one person just stared at me. I'm like, I'm kidding. If they
Um,
start doing this, I'm like, all right, geez.
yeah,
I just
yep.
told you they were okay. They're gonna be okay.
Yeah.
So Katie's looking for that. So we'll try and get that in the show notes. And hopefully we'll have that there along with a couple other resources. But as long as we don't have any other final thoughts from you guys, no.
Trust
Okay.
yourself.
Yes. Yeah. Trust yourself. You know what you're doing. And it gets easier for those EEPs. It gets easier as you do this longer. So That's all for today's episode. Thank you so much for listening to the CATA Secondary School Podcast. Thank you again to Katie and Ashley for joining us for a long one today and sharing their experience and perspectives and stories. It's always a fun time going through those. If you enjoyed the conversation, don't forget to like, subscribe, and share the podcast. We'd also love your feedback, so feel free to shoot us an email. It's in the show notes. It helps us keep making the show better and more relevant for you all. New episodes are released every other Friday, so be sure to check back for the next one. And until then, thank you so much for listening and take care.